Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you everyone for joining in this important and new session into the DAR conference. We have here a new opportunity of a dialogue with two experts. We have Dr. Sufyan Hussain from King's College in London and Dr. Gaman Mohammed from Nairobi. Both are endocrinologists, and I'm delighted to co-chair or this dialogue with my friend and colleague, Dr. Saira Sukwala from University of Aga Khan in Nairobi, Kenya. This is truly a unique session because the two people we will have the dialogue with, myself and Saira, are not just eminent diabetologists in the field of diabetes and Ramadan, but they themselves are people with type 1 diabetes and being Muslims as well as a background. So we have here the insights of a diabetologist as well as a person with diabetes. Quite a unique opportunity. I hope this dialogue will be fruitful. Saira, over to you for the first question.
Yes, so thank you very much and welcome all to this session. I'll start off with Dr. Gaman. Maybe you could tell us how your personal experience living with diabetes and particularly like with type 1 diabetes for the number of years you've had it. How does it inform your clinical advice to patients who are considering fasting in the month of Ramadan?
Thank you, Saira. Thank you for the organizers for this unique opportunity, and I think interesting topic. I've had type 1 diabetes for over 4 decades, close to 5 decades almost. And I have been in a setup of, in a third world, or you could say, not so conducive setup, as some people would put it. But this has given me opportunities, challenges. I've seen emotional satisfaction with fasting going through the years as I grew older with better regimes. So what has brought to me is not purely, what would I say, my teaching or my scientific background, but it's given me practical knowledge and also the fact that I am type 1. I've understood the acts of spiritual satisfaction, so all this put together and this understanding allows me to probably empathize with the patient's concerns, aspirations, and also informs how I approach my patient. And of course, thinking that here I must try and avoid harm, but how can I allow them to fast and fast safely? So this two perspectives, my personal, journey with type 1 diabetes and fasting, and also the clinical experience put together, has shaped how I look at Ramadan per se.
Maybe just to add to that, just one addition is yourself. At what age did you start fasting in Ramadan?
So traditionally, we normally start much earlier with half days. So I kind of missed that because of the type 1 diabetes. Of course, society, family had not heard about anyone fasting. So I started fasting the few days at the age of 13, 14 years. I'd been diabetic for about 6, 7, 8 years before then. So I started later than my peers or my friends. So that also was it was a stigma because I was the odd one out. You started a bit later. And it started with trying, failing, and then you would have disappointment, you would have uncertainty whether you can fast. Then you had pressures from family saying you can do it. You went up to 3 o'clock, stay on till 6 o'clock. At that time, maybe you're having a hypo, and we didn't have glucose testing strips those days. So, those were when I reflect back, I realize all these things we talk about when someone is the family being involved, knowing the signs of hypos are all important factors. So I started at around that age.
Okay. Very, very useful insights, Gaman. Sufyan, you live in London and you work in London. You've been in UK, born in UK. How was your experience there?
I think,
How?
yeah, and I think, obviously, going back to the original question, how it's informed, obviously the lived experience and the practical side is really helpful when you're looking after people, because you get people from different backgrounds, and even though their background might not be similar, the emotions that Gaman talked about in terms of stigma, in terms of disappointment, frustrations, you relate to that much better to understand where they're coming from. But going back to your question as well, is so I've had type 1 for now approaching 34 years. And alhamdulillah, while things have been good, I actually grew up in a third world country as well. So I grew up in Karachi in Pakistan. So it was a very different life that I had till my late teen years, and not having, again, a lot of the things that we have now. Even the strips were very, you didn't have many of them back growing up in the 90s. It wasn't something you could use for more than once a week. So the potential to fast was very limited. And in fact, I had a lot of um, family who were concerned about me fasting, which is why I actually didn't start till much later, probably in my late teen years when I was in the UK, when fasts were much shorter. But again, it was a case of failing, a lot of failing, and a few things happening that made me rethink whether this was a safe option till much later when I started having CGM, and that's when things became a lot more possible. So I think the initial, I guess, short of it is, even when the fast was shorter, it was proving to be very difficult. I guess where being in medical school and then shift work didn't help on top of that. Even with a pump alone, it was very, very hard. Afterwards, with a sensor and closed loops, and I've been on a closed loop, alhamdulillah, since 2019, and with that, it's been much, very, very possible. In fact, even fasting and staying active, which I can talk about later.
Very, very important insights. Go ahead, Sarah.
Yeah. So in the same vein, maybe with Dr. Sufyan, you'll tell us, with your experience, having started fasting when you were still a teen, a bit later, and living with diabetes, with all the challenges, how do you counsel patients now, your patients who come to you with type 1 diabetes who are considering fasting?
Yeah, absolutely.
Based on what you've gone through.
Yeah, so it all depends on the individuals, and one of first consideration is making sure from a medical point of view there are no hard reasons why they shouldn't be fasting. For example, the presence of complications, microvascular, severe and organ issues, which would absolutely be a concern, hypoglycemia awareness issues, pregnancy as well on top of that. So any medical reasons that would come in the way of them doing so. But then I think the most important aspect is, what access do they have? Access means access to education and understanding of and their knowledge around diabetes and diabetes management, and what therapies they have available. Now in the UK, for the last few years, everyone has access to continuous glucose monitoring, which I think is a really good safety net, because it gives you alarms. But I'm aware that that's not the case through the majority of the world. And similarly, even in Pakistan, where I still have strong links with, I know that, again, that isn't an opportunity that most people can take advantage of. So it's realizing what resources they have, to make it safe for them. What are they doing? What is their social background? What is their prior experience of fasting? What have they done, to try and then understand, is this something that's safe for them? Should they be doing it? And if obviously the answer is yes, and a lot of people now we encounter, we can support with fasting. We then make sure that they're doing it in the best possible way with the right adjustments, and ensuring that they stop it when they should be stopping it. But those who don't, again, we advise them that reasons why they shouldn't be doing it, they are exempt, and what options they have for making up for them. Whether fasting in the winter periods, in terms of making up for fasts, is permissible in their situation if longer fasts are more risky. As you know, the fasts in the UK were very long. They still are slightly longer than what you might be having in your areas, but they're very long, and they were very long, and that was obviously a different situation. So I think those are the sort of things that come into the mix, but I completely see where people are coming from when it comes to recognition of the stigma, of that desire to feel and experience what normal people are going through. what that desire to be involved in their family or communities, because it is a very collective affair as well, and that's where fasting is and understandably a very important part of people's identity. The similar way in which when I look after people, who come to me saying, hey, I want to climb Mount Kilimanjaro with my friends because that's normal for my experiences. So, so our job as healthcare professionals is to try and support them as much as possible, provided it's safe to do so. So yeah, I hope that answers your question.
Yes, yes, thank you. And so what you're trying to say is that it's not an all or none. It's individualized based on what
Absolutely.
experiences,
And I think you
what
have to.
access and what availability one has to monitoring and to the facilities
Yeah, and the
to
situation
safely fast.
in the UK is very different now
That's
because
good.
we've got a lot more monitoring available that makes it permissible
Yeah.
for people who don't have complexity in their diabetes care and who do have the knowledge and understanding. Yeah.
What about yourself, Gaman?
Mm.
With your experience of personal experience, how then you transfer this into the counseling of the person with diabetes in your clinic? Does it help you? Does it help you to maybe think of essential or main tips that you give them?
Yeah, I think first when I see someone, or my first point to them is I acknowledge your desire, or I understand why you want to fast. I start there, that I do understand that you want to fast, but this may be the challenges. But let's work together and let's try and modify a few things to see if it can work or not work. I sometimes use the pre-Ramadan planning as a tip. Let's try and fix your sugars now, because maybe we can fast better during Ramadan. So it kills two birds with one stone. We sometimes agree on pointers that we must try and do, like monitoring. You must try and get your monitoring done. And me and Syra are looking at projects where we provide free glucometers and strips during Ramadan to type 1 diabetics, so that you don't have an excuse now for monitoring. At least I kind of put monitoring as a must when we are negotiating. So you kind of negotiate, and then I try and prepare them mentally also, that look, there may be some emotional challenges. There may be days you may have to break your fast. Don't feel ashamed. Forget what everyone is saying, that 2 hours are remaining and you broke your fast. You feel unwell, break your fast. So there's both the mental, the physical preparation. And I think, having gone through this myself and even had failures when I was on a closed loop system where you can never be prepared. There's no 2 days of a type 1 diabetic are the same. I went for Umrah once and I said, I'm going to fast during Ramadan there. And my first day there, I had to break my fast, despite having the closed loop. So these things can happen. And I think if they understand that, then you have this situation where people have realistic expectations. The other way sometimes I go around challenges with is I try and look at if we can have them fast a Friday, the last couple of days. It may give them some sense of fulfillment, in patients who have vast challenges with fasting. Again, this is, as you all say, or we all say, that, it's not, there's no one hard fast rule. We just have to think through that. How can we have people fulfilling their religious obligation and raising their spirituality during this month?
It's quite interesting that you've both in your answers mentioned the importance of the infrastructure. Sufyan feels a lot happier with his service now in UK. He's able to provide the CGMs and the technology in comparison with, for example, you, Gaman, saying that yourself and Syra, part of your charitable missions and diabetes society work is to raise funds for simple glucose monitoring. So clearly the disparity between one type of service to another, and also on your reflection on that even on a closed loop pump, you had some days that were difficult. So the technology helps, but it's not bulletproof. Sufyan, when you're counseling your person with type 1 diabetes, how do you reflect on your own experience and how does it help?
Sure. So yeah, no, firstly, your first point is absolutely right. It's all down to the health system, which dictates the level of risk for the individuals going fast. So I know we talk about, risk stratifications, but I think it's ultimately down to the health system that dictates the overall risk for the population. And of course, even in my population, there'll be some who are higher risk because they're not able to undertake some of the things and actions that are needed to keep it safe. So yeah, you're absolutely right. And going back to Gaman's comment, anything loaded with insulin, even if it's closed loop, is liable to cause hypos or low sugars. And these things happen even outside fasting. And it doesn't mean that it's a high risk because a lot of people will have hypos during the week, even outside fasting. So it's just recognizing that it's as long as they know that they need to stop fasting and break their fast. So going back, in terms of counseling side, I think firstly, both Gaman and I have given a perspective of how we recognize the individual's desire. The bit I always do emphasize, even in those, let's say on the highest end closed loop system, who are doing very well, have good knowledge, that they are exempt from fasting. So as long as they recognize that this is a situation which they're exempt from because of the risks associated with it. So when they do it, they recognize that they have the allowance to not fast should the circumstances change, should they get an infection, should the the situation in the household change, which means that they can't maintain the same routines, which throws their sugars off completely. And I have that a lot with young mums who've delivered and used to fast before children, but now their routines are so different. The social challenges and pressures make their sugars very difficult to manage. So I think it's putting that into perspective as well, and giving them that option that it's not about putting themselves at risk or danger, and provided they have the right understanding and know when to stop, we can then work with what they do desire to do and move forwards. And I agree with Gaman that we would want to look at opportunities such as shorter periods of fasting during Ramadan, test fast before. It's a bit like running a marathon. When my marathon runners come, they don't run a marathon the next day. They will run and build themselves up. So similarly with Ramadan, you would fast the shorter periods, maybe to test your ability to fast. If you're new to fasting in Ramadan, in the winter months, you can test and see and build up towards understanding how your body reacts during Ramadan. So I don't know if that answers your question, but I'll leave Gaman to fill in any gaps.
I think it does. I would love to ask you both, but maybe I can start with Gaman about your top 3 tips or top 5, whatever number you would want to think of, that you would give a person with type 1 diabetes who want to fast, based on your experience as a diabetologist with understanding of Ramadan, as well as being yourself a person with diabetes. In your own circumstances, Gaman, and perhaps Sufyan can repeat the same in his own circumstances. So let's assume, Gaman, that your patient have the less resources. What would be your top tips? And maybe Sufyan can think of the person with the better resources.
I think my first tip is be honest with yourself. Can you fast? Can your body take it? Are you aware of your limitations? Again, as Sufyan said, that it's all about, you have an exemption. It's all about intention. So try and bring that in. Pre-Ramadan preparation, monitoring, follow up as much as you can when you have a problem. Those are some of the advices I think I would put as my priority. But Mohammed, most important thing I think is a reflection that, can I fast? Am I really able to fast? That coming from yourself first. Am I able to fast? Why do I want to fast? Those are all things that, am I fasting because my friend's fasting, my teenage friend is fasting, and I feel left out, and I'm struggling there in the afternoons, and I'm having problems. So those are some of the points here.
Very, very important points. And
Good.
Sufyan, what are your reflections on
So
the
obviously,
top 3 or the top 5?
if you're working with someone who is you're looking after someone who's in a setup like ours, or even, let's say, from the Middle East, where I look after some people who come and visit from the Middle East here to see me, and they have access to technology. So obviously use technology. It's your ally. The fact that you've got a system that can alarm and alert you ahead of going low, or issues when you're high, is a big help, but it's not foolproof. But use your technology. 2 is peer support. So look out for those channels where you can get access and support from others. It's the same thing I tell people if they're climbing Mount Kilimanjaro, or if they're going for long distance marathon running, or if they're doing anything extreme. Whether it's climbing up to very high altitudes, you work with those who've done it before in your situation to understand the journey and understand what they are doing as well. My experience is just the one person's experience, but linking with others, also with that emotional support, and through Ramadan is very helpful, because they can then discuss their challenges, their experiences, and refine things better. So that's 2. And number 3, plan your routine. When I work with my marathon runners, they know what they're going to be eating, not just before, not just during, afterwards. They know how much, they have everything set in stone. Fine, it may go off, it may throw things off, but as you know, the culture of fasting, particularly with I'm sure Asian and Arab cultures, and I'm sure the same in Africa, there's a lot of feasting. There's a lot of feasting, and it's very spontaneous
Absolutely.
feasting. You have to be disciplined. Your
True.
food routine is absolutely fundamentally important, and even more so if in an environment like Gaman's, where you have strips. You have to control the variables you can. So don't let this become
Very
a
true.
variable. And similarly, so you've got to really be disciplined and plan your routine. So similarly, when I work with someone who I looked after, did the Marathon des Sables around the Sahara Desert with type 1 diabetes, 7-day, in the Sahara Desert running. How did he do that? He planned his meals and food, which he had in his backpack, because that's what he can carry, right down to the very last carbohydrate, very last glucose tablet, because he can only carry a limited amount of food. And I'm not saying that level of precision is needed, but you need to plan your routine. And this is really important, type 1 or type 2, that you have to be very, very disciplined when you're going out for iftar parties, or you have to know what you're going to have in advance, if possible.
And while you bring the aspect of the iftar parties and feasting, so you see, it's like Ramadan is it's a time when families come together, when there's a lot of social gatherings, events taking place, and so I think it would be probably just good, because it's a family issue and a family affair. So it'd be good to engage the family. So what advice would you give based on your experiences to families and caregivers in how they can support, people
it's
living with diabetes who are planning on fasting?
Yeah, so it's a difficult one. Gaman, I don't know if you wanted to go first,
I think I want to just add on what Sufyan said. So what I've done at home, and I try and implement 80% of the times, unless we have guests all over, is have a structured meal. And I tell everyone, have a normal dinner, like you'd have during the non-Ramadan. And if we have 5 people, have 5 samosas and 1 samosa on each plate. So we're kind of, if you're a type 1 and you're going to pick the second and third samosa, you're limited there, and then you have your normal meal. So this way you're having some structure, and I totally agree with structure is important, and meal planning should be also part of a family affair. And I think that those are some of the things that maybe Sufyan will dwell on, and I can add on as part of the support structure from the family as well. Yeah.
Yeah. No, so I think, getting the family right support is important, although there are situations where it may not be possible when you're going out to others, and you may not want to reveal or talk about Ramadan, your condition too much. And then it's being sensible with the choices that you have, the food options you have available. And that becomes from recognition and knowing what foods have very high carb, very high fat, what's going to be cause problems to your sugars later on, and make the next day's fast more challenging, or make the overnight recovery more challenging. Because again, in the UK, when we had the longer fast, you only had a small window to recover. And that small window is really important to make sure you don't go very high. You can drink the fluid so you don't lose too much hydration. So hence why that routine and structure is really key. And so in a spontaneous situation or in a situation where you're out, you just have to be very good at knowing what food options to take and be very disciplined in that, because otherwise your next
Maybe
is going to
directing you to like, what advice would you give the caregivers of, like, let's say you have a child, like an adolescent who's trying to, who is intending to fast and they're fasting. What advice would you give to the caregivers, like recognition of hypos or anything additionally that you'd like to, based on what you have gone through probably, and you know, where you'd had to break your fast probably because of one reason or another, what kind of advice would you give to the family in that regard?
So I think essentially recognizing the same thing around it. This is a situation that can have risks, and supporting the individuals and encouraging them to break their fast if they've reached a situation which they feel doesn't look right. And we often, even with CGM now, we see the scenario of people prolonging their fast because they've got, as Gaman was saying, there's 2 hours left, because for them it's a failure. It's a bit like someone running a marathon but having to stop and drop out.
And I think if this strikes strongly with me, because if I remember my youth and one of my first fasts where I must have been having a hypo, and everyone around me kept saying, you just wait, you're hungry, you just wait, you just have another 2-3 hours to go. And I clearly remember the time, the place, the house I was in Mombasa, I wasn't in my home place. So you can see that it has caused some degree of trauma on me, or it has significantly impacted on my thoughts, because I do remember that day and I do remember what happened. And I was obviously having a hypo, and I just managed to prolong it because of I think maybe lack of knowledge. So we need to make sure that the family also learns about diabetes, learns how to recognize that these are hypos, these are hypers, and how to respond, and not judge the person that he actually chickened out and broke their fast at 12 o'clock because they couldn't take it. So I think that open communication is really, really very, very important. Another aspect that is very, very important from the family is the days the person doesn't fast. I think it's important to bring them on, have them have the suhoor with you, have them break the fast. That may create this psychological feeling that they participate in the fast. And of course, make it easier for them to eat in between the fast without feeling, like they have to go away in one corner and feel like it's a taboo or a stigma.
We have
Excellent.
minute and 40 seconds left. Perhaps it's an opportunity for me to sum some of the very, very, I didn't know that this session would be such an insightful session, talking the 4 of us together, mostly you, Gaman, and Sufyan, doing the insights with me and Saira asking the questions. But I've heard a lot of buzzwords. I heard the word feel of failure, and which is obviously it shouldn't be. The words that the infrastructure about what circumstances the person is in. The fact that no matter how much technology the person has, it is still possible that the person might not be able to fast. The words about the importance of the support of the family and the peers, as well as the peer pressure that the individual would be in, as your experience, Gaman, of people pushing you to carry on fasting when clearly you could have been hypoglycemic or possibly were hypoglycemic. The reality that we need to spend not just much time to make the person know about the insulin dose adjustments or the adjustment in the technology, but the understanding of, at the end of the day, the Quran and Allah subhanahu wa ta'ala, Rahman ar-Rahim, says whoever is ill or on a journey, and that these people, while they are very passionate to fast, nevertheless, they also have a license not to fast. They should not feel the pressure. They have a license, and we need to work hard to make every person with diabetes, every diabetologist and healthcare professional understand that it is not easy. If it was not easy for two eminent young people and then diabetologists to be able to fast for some of the days, certainly for the simple person who maybe from a different background, scientifically or financially or whatever, could be even at more difficult times. And also understanding that it's possible for many to fast, specifically with the advances in technology. So the glass is not half full or half empty. It depends on many days, and in some days it will be full, in some days it will be not so much. So I hope that everybody have enjoyed these sessions. We run over time. I'd like to thank my co-chairs, Cyrus Akwala, very much, and certainly our experts in this session, Gaman Mohammed from Nairobi, Kenya, and Sufyan Hussain from London, UK, of this very insightful information. I'm sure we will benefit from more of this insightful discussion in the future. Thank you all.
Thank you.
Much.